Okay, this is segment one. First off, I'd like to say welcome. My name is Carmen Price, and I'm going to be working with your family probably over the next couple of weeks. Um, just a few words before we get started about kind of how the structure of these meetings will go. This first meeting, I'd like to get to know you and your family and what you would hope to get out of this experience. And so we'll go around the room. If you could tell me your name, your age, maybe just a little bit about yourself that you'd like me to know. And then we'll continue around the circle until everyone's introduced themselves. And a little bit about the structure of the meetings as we go along. The main thing is we want to have a mutual respect for all family members in the room as we're going through the meeting. So if someone else is talking, if you could try not to interrupt. If you do have something you'd like to say or a question, if you could wait until that person's done speaking before you say what you would like to say. And as far as goals, one overall goal that I would have in working with your family would be maybe to enhance or better communication between the family members. A lot of times when there's a difficulty within families, it often stems from maybe difficulties in communication. So that'll be one thing that we'll be working on overall as the sessions go on. But mainly, I would like you all to set the goals that you'd like to work on. You know your family better than I do, and you know what you would like to get out of this experience, what you would like help with. So we're going to work probably between this section and the next to come up with a list of goals that you'd like to work on, that you'd like to achieve by the end of our sessions together. Okay, now with that said, I'm going to go ahead and start to the right here with Mom. And if you could introduce yourself, say your age, and maybe a little bit about yourself, whatever you'd like me to know about you and your family. And then we'll continue to the right. Okay, that's the end of segment one. Segment two. I hear what both of you are saying. I just want to maybe take a time out for all of us to take a deep breath. Try to breathe in through your nose, breathe out through your mouth, and hopefully you feel yourself calming down. Sometimes, especially in families, when there's maybe a conflict or we see things differently than someone else, that's when tensions can start to rise or blaming each other starts. And I'm a firm believer in blaming is not going to help solve the situation. It's not going to make either one of you feel better. So I don't like to place blame in these sessions. What we want to try to do instead is to try to talk through our problems. And I'm actually happy that this happened while you're here, because this gives us a chance to practice some of those skills we'll be working on throughout the session. If one person can talk first and try to express to the other person in a fashion that's not blaming or kind of in the you did this or you do this fashion. When we say things like that, it tends to make the other person automatically defensive. So if you could instead maybe try to use the format, when this happens or when this occurs, I feel this way. That way it'll help the other person better understand maybe why you were upset or why you were feeling a certain way, instead of blaming each other for what's going on. Okay, that's the end of segment two. Segment three. Okay, well, we've come to the end of the session, and what I'd like to ask is, we worked on kind of talking about some of the goals that you'd like to work on over the course of the next few weeks. But if you all could sit down as a family, with everybody joined in, and as a family, come up with some joint goals that you would like to get out of this session, what you would actually like to achieve by coming and meeting with me. and meeting with each other in this space. If you could make a list, and it's up to you, it can be, I would say, as few or as many goals as you would like to work on. I'd like to challenge you to come up with at least three, and try to make them something that you think is definitely achievable. You don't want to set a goal of, we're going to have a perfect family in 6 weeks, because that's not really realistic. And you want to set goals that you know you're going to be able to achieve, because I want this process to be empowering for all of you. And the more likely you are to meet your goals, the more you'll feel empowered. So if you all could take some time in the next week, and you can talk about some of the goals that we talked about during this section, and kind of as a family, come up with which goals you would like to be your set goals, for working on in a treatment plan going forward. And if you could bring those to the next session, that would be great. Do you think that's something you guys could do for me? Okay, that's the end of segment 3. I hope this went okay, and those are some of the skills or things I would say to a family in a first session. Thanks.